As we all know, hair loss is a frustrating issue which most of the females would have faced at least once during their lifetime. Now, hair loss can be either physiological or pathological. Physiological hair loss is a normal hair loss which we all have on a day-to-day basis. Pathological hair loss is when we have more than 50 to 100 hairs shed during a day. This can be understood if we have widening of our partition line, or if there is frontal recession, or if there is decrease in the volume of our ponytail. Now, hair follicle passes through three phases of growth as well as shedding. The first phase is known as the anagen phase, which is a growing phase of the hair follicle which lasts for about 2 to 10 years. The second is a transition phase which lasts for only 3 weeks, which is known as the catagen phase. And the last is the telogen phase, which is the shedding phase or the resting phase of the hair, which lasts for only about 3 months. Now, in a normal healthy scalp, only 10% of the hair are in the telogen phase. So, only 10% of the hair are in the shedding phase. The common issues by which females come to the dermatology OPD with a hair loss are: one is diet associated, that is nutritional deficiency. That is usually seen in young females who follow a diet, and because of the nutritional deficiency they will have a hair loss. So in such a case we have to correct the nutritional factors. The second kind of hair loss is hormonal hair loss. It can be seen in two age groups, one in young females who are in between 20 to 30 years, and the second in older women in the perimenopausal age group, that is between 40 to 50 years. In hormonal hair loss, there will be frontal recession of hairline, there can be widening of partition line. Now, when a young female comes with this pattern of hair loss, we have to see for underlying pathologies like a polycystic ovarian syndrome. So we have to see if the patient is having cystic acne, hirsutism and menstrual irregularities, and this only when this is corrected, the hair loss problem will also be solved. The third kind of hair loss is telogen effluvium. Telogen effluvium, as we have already said, telogen hair is the hair which is in the shedding phase. So in telogen effluvium there are two types: acute telogen effluvium and chronic telogen effluvium. In acute telogen effluvium there will be hair shedding following an acute injury, like it could be following a surgery, it could be following a prolonged illness like a fever, like typhoid fever, malaria or tuberculosis. It can be following postpartum, that is following a delivery, or it can be following intake of certain strong medications like cancer chemotherapeutic agents or anti-epileptic medications. In such case, the patient will have hair loss, and about 20 to 25% of the telogen hairs will be shed, and this hair loss can be restored within a period of 6 months. The second type of telogen effluvium is chronic telogen effluvium, which is seen in elderly females of the perimenopausal age group. It is a severe kind of hair loss where about 400 to 500 hairs are shed during a day, and the hair loss lasts for a period of more than 6 months. It is difficult to restore the hair in such patients. It may take up to 6 to 7 years for the hair to come back to normal. Now, there are also other causes of hair loss. One common cause is alopecia areata. It's an autoimmune condition where there will be patchy or circular area of hair loss on the scalp. So all these hair losses can be seen in dermatology OPD, and usually the patient does not come with a single cause. The hair loss can be multifactorial. So whenever you find that you have hair loss, you have to visit your dermatologist to ascertain the correct cause and to take the correct treatment. What can be done on a daily basis to protect your hair and to maintain a healthy hair? Whenever you are washing your hair, always remember to use an essential oil to massage your scalp, as this will help in increasing the blood circulation in the scalp, and also massage the oil onto your hair shaft, as this will help in maintaining a normal moisture content of your hair. Always use a mild shampoo to wash your hair, and following that use a conditioner, as the conditioner will help in maintaining the moisture content and prevent hair breakage. Following this, don't use hot air dryers or vigorous rubbing of the hair. You have to use a soft cotton towel to mop off the moisture out of your hair, and only once the hair is fully dry, you have to comb your hair, that too with a wide tooth comb. Avoid hairstyles such as tight braiding of your hair, tight ponytails, as well as use of metallic clips on your hair, as this can result in hair shaft breakage and also result in traction alopecia. Above all, we have to maintain a healthy diet which is rich in proteins and vitamins to have a healthy hair. Here in the Department of Dermatology, Badal Sama Salala, we see both medical as well as cosmetic dermatology patients. We also have inpatient facility. We do the following cosmetic procedures: platelet-rich plasma therapy, chemical peeling, intralesional steroid injection, cryotherapy, derma roller and electrocautery.